I'm Tyler Fight. I'm in medicinal chemistry at Valdosta State University. Currently, Italy leads the world in HPV related diseases. The geography of Italy is mostly rugged and mountainous, with some plains and coastal lowlands. The climate of Italy is primarily Mediterranean, with it being alpine in the north, continental in the middle, that have harsh winters and hot summers, and it being hot and dry in the south. The lowest point of Italy is the Mediterranean Sea, with the highest point being Mont Blanc. Italy also lies on a fault line, so it is prone to earthquakes, and Italy has the only active volcano in Europe. The population of Italy is 61.5 million, with a population density of 520 people per square mile. To put that into perspective, Italy is about the same size as Arizona, and Arizona has about a sixth of the population. The population is also wildly uneven, with more than half being located in the Po Valley, and then Rome and Naples. The life expectancy of Italy is 82 years, and that can be due in part to the universal healthcare system, since they've had it since 1978. Although contraceptive use is about 62.7%, which could account for their high rate of HPV. The government of Italy has changed since it became a nation state in 1861. Started out as a parliamentary government and shifted to a dictatorship in the early 1920s under Mussolini. After World War II, it became a democratic republic in 1946. The current president of Italy is Giorgio Napolitano, and the Prime Minister is Enrico Letta. Next is the economy of Italy, which is industrialized in the north and in the center, and it's agricultural in the south. Instead of multinational corporations like in many other developed countries, they have many small to medium-sized companies that specialize in superior crafted niche products. Italy has a high public debt of 126% and high levels of corruption that make up about 7 to 17% of their GDP. They also have high levels of unemployment that are about 12%, and youth unemployment is especially high at 35%. Now that we're done with the background information about Italy, we can get into the human papillomavirus itself. HPV is the most common sexually transmitted disease. Infects both genitals of the male and female, and can also infect the mouth and throat. Anyone having sex is at risk, especially if you have multiple sexual partners. Most people who have HPV don't know they have it, and they don't show any signs of having it. There are over 40 types of HPV. It usually passes during vaginal and anal sex, but can also be passed through oral sex as well as genital to genital contact. Most HPV infections don't show symptoms or create health problems. They go away on their own in the next 2 years. But it can often cause genital warts and certain cancers like cervical cancer in women, cancers of the vulva, vagina, penis, or rectal cancers, as well as oropharyngeal cancer, which is cancer of the back of the throat. There's also a rare condition called RRP, where warts grow in the back of the throat, and very rarely where HPV is passed from mother to child. You can also have multiple types of HPV at once. Next, we're going to take a look at prevalence of HPV in Italy. A study took 1,006 women ages 18 to 24 in Sicily, which is in the south of Italy. 253 were shown to be HPV positive, which is 24.1%. The high risk types 18 were found, and 14 low risk types were found. The most frequent found were HPV 16, which was found in 4.5% of all the women, and 2.7% of all the women had HPV 53. 42.8% infected had multiple infections, multiple types of HPV, and women with multiple sexual partners were almost 4 times more likely to be infected. The high rate of HPV in Italy could be because of multiple factors, including high unemployment rate among the youth, as well as low contraceptive use, and immigration from Eastern European countries and Africa that have high rates of HPV. Next, we're going to take a look at drugs that can be used to combat HPV. The first being aspirin, which can be used as a painkiller, fever reducer, and an anti-inflammatory. HPV vaccines have side effects, which include fever and headaches, and aspirin can be used to combat those side effects. Next, we have imiquimod, which can be sold as Aldera. It's a prescription cream that can help fight HPV by boosting the body's immune system. It can be used to treat warts around genital or rectal area. It doesn't kill the warts directly. It just boosts the body's immune system. Side effects include redness and swelling around the infection site. Now there's Podopolox, which can be sold as Condolox. It's a topical prescription that destroys genital wart tissue caused by HPV. Even though the genital warts are destroyed, you can still transmit HPV to others, and you can still have it. Side effects of this include burning, redness, itching, swelling, and some pain. Next, we have the best weapon used against HPV, which is vaccination. This helps prevent sexual transmission of HPV and can also help prevent cancers later on in life. There's been a lot of controversy surrounding vaccination, but studies on the vaccine's safety have shown little to no evidence of severe side effects. And it's been shown to be a safe vaccine. I would like to thank you for watching, and I hope you found my presentation informative. I'll include more links for more information.